Y'all listen. I'm actually just reposting another video that nurse, I think Erica is her name, that she already commented on and her take on it. I'm just resharing that video, so just giving her credit for her video. But listen to how this surgeon talked to this nurse. Y'all, could not have been me. Probably would have lost my license, but this is why it is so important to stay calm. This nurse did a wonderful job. She stayed calm. She stayed, you know, she did what she was supposed to do. I don't know if I could have done that. But just take a look at this video and leave your comment below.
Where is the section? Where is the section? All right. Here's where you lack intelligence, okay? Do you think I know the sucker's sucking? All right, so 29 years of sucking fluids out of patients with suction. Do you think I know if it's working or not? No, don't talk back to me and listen. I don't give a fuck how long you've been a nurse. Your nursing is shit. You don't know when a sucker is sucking. I do. As a surgeon, I do. Goodbye. Dumbass. Let her go. Fuck her. A stupid bitch. You think a surgeon doesn't know when a sucker is sucking or not? Okay? This is not sucking. It has to be our goodbye. Goodbye. Get out of here. I don't know. I'll know in a few minutes. Okay? But a little suck is not suction. It has to be strong. Okay? When I say it's not working, it doesn't mean it's off. It means it's not sucking hard enough. There's a problem. That dumbass couldn't figure that out. How many times have I told her that?
Yeah, they keep all me too. That's it.
I mean, you guys are fucking unbelievable. I'm doing revolutionary surgery here, operating on a spine, and you can't even get a fucking sucker to work? How hard is it? It's a goddamn suction machine. You make it sound like it's rocket science, like you've reinvented something great. Look, fire. We're the first to discover fire. No, it's a suction machine. It's not that complicated. Figure it out, learn how to do it right, do it the same way every time. I've never seen so many problems with one simple thing.
So, that was from a Facebook Live yesterday during a spinal surgery. I went back to the source because, I always check. And the live is still posted. However, that portion of the surgeon speaking to the nurse that way is mysteriously no longer posted as part of the live. The whole thing is over 50 minutes. I watched the entire thing. However, it does still include subsequent comments where people that were watching the live could comment, ask questions, and then his responses to it. So I'm going to play those for you.
We do have a question.
Sure.
Coming from Lanu on YouTube.
Lanu. I wonder, Lanu,
They're asking.
do you miss any of our surgeries?
They're asking, are you okay, Dr. Duke? I hope you find a good nurse soon.
Oh, I have great nurses, by the way. And to be honest with you, that nurse has done a great job for the most part. But for some reason, there was just a lot of attitude given and not doing the job properly. And, let's face it, we're in the middle of surgery. We're taking care of a patient. It's not a time to argue with the surgeon. Fix the problem. If you want to argue later. But when a surgeon says there's something wrong with a piece of equipment that he's using or she's using, they're usually right. I know it's hard to believe for some people, but we're the ones who use this equipment every day. As a matter of fact, I can tell you if the air conditioner is off by 1 degree in the operating room, right, Luis?
Oh, yeah.
Or the humidity is too high. We're very sensitive to those types of things. So, thank you for your concern. I appreciate it. Everything will be fine. The patient did well. Ultimately, that patient, we had to stop his surgery because, as a matter of fact, the delay that was caused by that nurse didn't help. It probably kept us from being able to fix one more disc. So it is what it is. We are limited sometimes by not just our patients, but by our equipment and the people we work with, right?
Current question, so we just got a comment from Lanu once more on YouTube saying in Asia, the hospital culture is strict. Nurses obey the surgeon with absolute. Any nurses that talk back to surgeons faces termination. Respect is deeply embedded in our culture.
Well, Lanu, I got news for you. It used to be that way in the United States, but unfortunately we've undergone this woke kind of mentality, and unfortunately things have changed in America, and it's not for the better. But I agree with you. It should be that the surgeon, obviously this is my patient, the surgeon needs to be in control. It's really a joint effort between everybody working with the surgeon being sort of the captain, and the anesthesiologist being the other captain. So kind of two captains. One is taking care of the patient's respiratory cardiovascular system, and the other one is doing the surgery and managing, bleeding and removing things that should be removed. But it's a collaboration based on respect and an understanding of what every person has to offer. And everybody in the operating room has a job. There's nobody here just kind of standing around doing nothing. And a lot of our people have 2 jobs or 3 jobs. So they're not just managing one thing, they're managing multiple issues. For example, Jordan does the fluoroscope, but he also does the endoscope, and he also troubleshoots some of the monitor issues and helps with moving the patient and things like that. And I mean, everybody here, I could go through all the names, but the point is everybody's got multiple jobs. We all work together as a team. But when I tell them to do something, they don't argue with me. They do it.
Thoughts? I've never been an OR nurse, so OR nurses, please weigh in. Obviously, we couldn't see what was happening with the suction or the sucker. Here's the thing. We as nurses cannot be responsible for equipment failure. That's not our fault. Secondly, it's never okay to speak to a nurse that way. And I think you must recognize that because you cut it out of the live that's still posted. I will say, because I did listen to all 54 minutes of it, he does go on for the rest of it to be very calm and provide really significant teaching, that I'm not excusing his behavior at all, okay? I'm just saying it does seem like he's doing some good work, maybe some cutting edge things, and really it was very educational, but holy shitballs, you do not speak to a nurse that way. And here's a shock for you, doc. It's actually nurses' jobs to speak up. Yeah, so long gone are the days of nurses just being subservient and not questioning orders and giving you our chairs when you show up and all the things. That is decades long gone, okay? It's our job to speak up, to question things. You don't have to like it, but that's the reality.
Y'all, that video was a lot. And excuse the language. I don't even curse, so but I just wanted to share that video in its raw form. Listen. Whew. This nurse she did amazing, but this is the reality of what some of us go through with these doctors and these, surgeons who think that we work for them and not realizing that we work with them, that we don't work for the doctors. And I think they get that confused and they think that they're our superiority, and that is not the case. And I'm one of those nurses. I am very subtle. I am very, nice and sweet, but I set ground rules from day one. I let them know what it is and what it ain't, and how you gonna talk to me, how you gonna speak to me, and we're gonna roll from that. We're gonna roll like that from here on out. But I understand that you got some of these big-headed doctors that you can't tell anything to, that they're so rude and disrespectful. And that's the reality of what we face in the nursing field. And it's sad because you can almost bet your bottom dollar that they're going to take the side of the surgeon versus this nurse. They'll rather lose a nurse before they lose a doctor. And that's sad. And that's why a lot of the nurses are leaving the field. They're getting burnt out. They don't, want to do it anymore because this is the reality of it. So I want you guys to drop your comments in below. Tell me what you think about this video. If you've seen it, if you've heard it. If not, tell me what you think about it and how would you have handled the situation. Have a good night, guys.